So this is the quick summary of what we're going through today. Morning, we're going to try to focus on more of the surgical aspects. So everyone that's placing implants, I think you should be ready to jump into full arch cases. We're going to talk about the difficult aspects and how do you navigate that first case and just go through a very, very predictable workflow to keep yourself out of trouble, out of those sweaty situations, less stressed, and you can do full arch cases from start to finish this way. So we're going to talk about the different options, some terminology with full arch dentistry. We're going to talk about two really important case planning aspects, like when you're planning this case, what are the main things you want to just think about so you don't miss? Then we're going to talk about specifically digital case planning. How should we line up this case digitally? We're going to talk about different types of surgical guides. There's really three, and I'm going to kind of really hone in on the one that I think you guys should be looking at for your first cases. Bone segmentation, pin guides, bone reduction guides. Those are some of the more complex aspects of this, and I like to personally do a workflow that attempts to avoid those aspects, and that's kind of what I'm going to teach. Like, how do we keep this simple and predictable, like I was talking about? We're going to talk about parts, like what are all the parts that we use to do full arch cases, from multi-unit abutments to cylinders, analogs, all that stuff. We're going to talk about that and like how we use that in a digital aspect and an analog aspect. We're going to talk about immediate loading. So we're going to kind of go over the basics of immediate loading. I think that starting off, I think it's very, very predictable to think about not doing immediate loading or alternatives to immediate loading. The most stressful part about full arch dentistry is immediate loading. And there's alternatives. We think about like the sexy aspect of teeth in a day, but it doesn't always have to be done like that. How do we keep this predictable, comfortable, so that guys can jump in, do this stuff right away, and not be scared of the problems or the complications, which a lot of times revolve around immediate loading. But we are going to talk about it, how to do it, some of the aspects, specifically like denture conversions, all the way from like digitally planning these things from the beginning. And then we're going to do lots of examples. We're going to go through cases, just kind of see like how this stuff's played out, like kind of start to finish walking through cases. Dr. Borisov's going to tackle kind of specific nuts and bolts, tips and tricks, things that we've run into, complications. Those are really important aspects of learning. It's like, hey, how do I handle like complications when this happens and this breaks? What do I do? So he's going to take over that aspect of it. After lunch, we're going to jump into more of the restorative phase. So implants are in, how do we make them teeth? And we're going to talk about analog, digital, marrying those two together. What's some predictable way to get accurate outcomes and in a quick time frame. So we're going to talk about the PMR appointment. Those that are doing hybrids are familiar with this aspect, but that's an important part of the whole restorative process. We're going to talk about verification jigs, what those are. Talk about my favorite restoration. We call it the thimble bar restoration, the bulletproof restoration. So we're going to talk about that and why we like that restoration. Full arch digital workflows, different ways to acquire data. So you got intraoral scanners, you got desktop box scanners, you got photogrammetry, that's just kind of the new hot up and coming digital component piece of technology. But really this is going to be focused on you guys and like what you guys are doing in your practice and how do you integrate right away, integrate full arch dentistry with the technology that you guys have. We're going to talk about like different screws, like all the little different screws that if you guys aren't doing a lot of multi-unit stuff, like a lot of this stuff's new. So we're going to break down types of screws, components, like how to use them, how to handle them, when to use what. And then we're going to finish with going over 3D printed temporaries. So this is kind of the exciting part, the fun part. A lot of you guys have 3D printers, and now putting them to like the next level use, like what's like the hot, current topics, and that's where, Sprint Ray has been awesome. So, you guys are using Sprint Ray, a lot of you guys are, and we've loved our experience with that company. So, they're continuing to just push the envelope really, really fast. 3D printing is just, soaring really, really rapidly. And I think in most of our careers, we're going to see, 3D printing come to and begin to replace milling. I think that'll be exciting to watch that. And then we're going to finish with doing some hands-on stuff with 3D printed temporaries. So everyone's going to get a 3D printed hybrid, and then we're going to practice staining, glazing, adding pink gingiva, getting your hands on like how do you build these little temporaries. Then you guys can take these home and use them as demos in your practice. So.